medicine and weight loss physician here in Las Vegas. I own Inspire Primary Care. We're going to be doing a weight loss Q&A today. A weight loss Q&A. Those of you who are joining, drop in the chat. Where are you joining from? I'm joining live from Las Vegas at Inspire Primary Care per usual. Drop in the chat. Where are you joining from? We're going to be doing a medical weight loss Q&A because you guys have been DMing and dropping some really good questions about our medical weight loss program. So I want to answer those because if one person has the question, other people may have the question. If you all have any weight loss related questions, please drop them. Welcome to everyone who's joining. Where are you joining from? And do you have any weight loss related questions? Okay. All right. I'm going to take a sip of water as you all join. Drop that in the chat and then we'll get started. Okay. So weight loss Q&A. And those who are just joining, I'm Dr. Jade. I'm a board certified family medicine and medical weight loss physician. I own Inspire Primary Care in Las Vegas. Welcome. All right. So we're doing just a little casual weight loss Q&A. The first question that was dropped to me, this one came through the DMs on Instagram. Shout out to you. All right. It says, is primary care included with your medical weight loss membership? So those who are new here, who are unfamiliar, at Inspire Primary Care, we have two tiers of our membership medical practice. We have our primary care membership, all right, where your board certified physician is an easy text or email away. And then we also have the medical weight loss branch of our practice, all right. That does include primary care, but also includes medications for weight management, okay? And we have a weight loss phase, a strategy and structure for the weight loss phase, and then we have a proven strategy and structure for the weight maintenance phase to help you maintain that healthy weight once we achieve it. All right, so for the person who asked on Instagram, is primary care included with the medical weight loss membership? The answer is yes, it is. Primary care. Oh my goodness. I love y'all. All right. Primary care. So we have Mom and Me MD says that red lipstick is giving life, honey. Thank you. You made me laugh mid-sentence. I was reading that. Thank you. You're enjoying the red lip. Okay. Giving a little something special for the camera today. So yes, thank you. I appreciate that. Where are you guys joining from? And yes, I'm distracted now, but I appreciate you. And yes, primary care is included with our medical weight loss. So even if you don't use the primary care component, it's still included. So because any good medical weight loss program is going to do a primary care screening, meaning there should be lab work done, there should be vitals being done, there should be a physical exam being done, okay? And so even if, everything is completely normal, that's great. Then you're a good candidate to continue on with the medication. But if there's prediabetes or diabetes or high cholesterol or high blood pressure or any other comorbidities going on, we don't have to say, oh, go somewhere else for your primary care. We just manage the weight. It's all inclusive. Okay. So yes, primary care is one aspect of our membership, but if we are utilizing medications for weight loss on that medical weight loss program, then yes, primary care is still included in that program. All right. And then Mom and BMD says, I'm sorry. It's good. It's all good. I appreciate you. I appreciate the compliment for sure. All right. The red lip was for you today. Okay. All right. And then the second question, drop in the chat where you guys joining from. And also let me know if you have any questions related to weight loss programs, weight management. I'm here to answer those questions for you, since most of the questions I've been getting questions about in the DMs and comments and things like that have been more related to the weight loss component. So that's why the Q&A is weight loss focused tonight. All right. So the second question I was asked is, how much weight, y'all love this question, how much weight will I lose and how fast will I lose it? Y'all, I do not have a crystal ball. I promise you I don't have a crystal ball or a magic wand, but I do know what the studies show. And I do know what we typically see with our current and previous members who have had amazing results at our medical weight loss program. So what I like to share is that in about a 6 to 12 month period, typical results are 15 to 25% of body weight loss with our medical weight loss program. I'll say that again because I know it's a little bit of a mouthful. In 6 to 12 months, the average or typical results on our medical weight loss program with our proven strategy and structure is about 15 to 25% of your body weight in that 6 to 12 month period. That tracks with what we typically see in studies when GLP-1s are utilized, okay, appropriately and effectively. And that is also what we typically see here at Inspire Primary Care. Just to give you some examples, I'll shout out a couple of our members. I actually had 3 medical weight loss follow-up visits today. And so I just jotted this down just to give you guys an idea because I know I was coming on live for you. So one of our members, shout out to you, congratulations, had a weight loss membership follow-up, weight loss visit follow-up today. They have been a member for 5 months, a medical weight loss member for 5 months in our practice. They are on our personalized wellness plan. They are following the wellness focused side in addition to utilizing GLP-1s, and they have lost 95 pounds in 5 months. 95 pounds in 5 months. I will say that this is a large result in comparison to some. Results may vary, but this is one example, 95 pounds in 5 months, okay? Another member who I had a check-in today with has been a member for 3 months, all right? And they have lost 20 pounds in 3 months. And then I had another member, the third that I had a follow-up with today, that has been a member for 4 months, and they have lost 35 pounds. So we have an example where someone has lost 35 pounds in 4 months, 20 pounds in 3 months, and 95 pounds in 5 months. Results will vary, but the thing to know is typical results for our medical weight loss program in a 6 to 12 month period is typically about 15 to 25% body weight. Okay, I hope that answers that. And then drop those questions. I will answer them. I will answer your questions. So I see, forgive me if I pronounce your name wrong, okay? Jaqui, Jay, all right, how did I do? Let me know. And where are you from? So the question says, have you seen sustained weight loss after stopping Ozempic? So this is a great question. And this actually transitions into question number 3 that I was asked. So I'm going to answer question number 3 and integrate that into your question, okay? Question number 3 I was asked was, do I need to be on weight loss medications forever? This is a common question. I like this question because we want to be thinking about this not as a fad diet. We want to be thinking about this. What does this look like as a lifestyle tool? What does this look like as a lifestyle change? All right. And so what I tell people and what the true recommendation should be when people ask, do I need to be on weight loss medications forever, is there should be a strategy and structure for the weight loss phase, and there should be a strategy and structure for the weight maintenance phase. In the weight loss phase, we do have a strategy and structure here at Inspire Primary Care to help our members transition to their healthy weight range. We don't look at BMI only. What we call our healthy weight range is a combination of 2 things. The weight in which you feel your best, you feel good in your clothes, you have good energy, you're not on a CPAP at night because you can't breathe at night, you can exercise, you can move around, you can chase the kids. Okay, that weight range in combination with the weight range in which your chronic disease burden is the lowest, meaning you have a healthy blood pressure in that weight range, you have a healthy cholesterol, you have a healthy blood sugar, okay? That combination, the lowest chronic disease burden weight range in combination with that weight range where you really just feel your best and can do the things you want to do in your life in that weight range, we call that here at our office the healthy weight range. So in that weight loss phase, we decide together, what we think that healthy weight range is for you, and we help you to transition towards that healthy weight range in the weight loss phase. Proven strategy and structure for that. Once we get you to the weight loss phase, or once we get you to the healthy weight range, then the key part that a lot of weight loss programs and weight loss clinics do not have is a strategy and structure for weight maintenance. So this transitions into your question here, okay? And that is, do you typically see sustained weight loss after stopping Ozempic? Depends on the person, okay? Because there are different reasons that different people struggle with weight. It is a complex chronic disease, and it's not necessarily a chronic disease. Difficulty with maintaining a healthy weight, being overweight, being obese, it isn't necessarily a chronic disease for everyone, but it is a chronic disease for many people. So what that means is, for example, if you have someone who broke their leg and they were immobile for 6 months, and because of that, they weren't moving as much as they typically do, and they were more of a couch potato during that time, and so they gained weight because of a situational reason, then they would typically be a patient who we may get to back to their healthy weight range, get to their regular mobility in life, get back to their typical way of eating. They don't necessarily have a genetic predisposition for struggles with weight, and and they may be able to maintain off of the medication free, and still maintain their healthy weight range. That's one example. Another example is pregnancy. So you may have a woman who never really struggled with her weight, but then she had babies, she gained weight during pregnancy, whole lifestyle was changed during that. And then once they join the medical weight loss program, we get them back on track, get them to a optimized wellness plan for this season of their life, being a busy mom, and take away the medicine for weight loss. And they, again, may be able to maintain their healthy weight range medication free. You have another whole pool of people who the reason they struggle with weight is not just because of how much they move. It's not just because their nutrition is poor. It's not just because they're getting poor sleep, or it's not necessarily only because of lifestyle. There may also be a genetic predisposition. Everyone in the family struggles with obesity. They've struggled with obesity their whole life. That is going to be a person where the difficulty maintaining a healthy weight is more complex than just eat healthy, move more. And for that population of people, they may need or require medications for weight loss in combination with a healthy weight plan, healthy wellness plan, a personalized wellness plan. They may need that combination long-term or lifetime. And that should be personalized to the individual, just like high blood pressure, high cholesterol, or chronic diseases. For some people, obesity is a chronic disease, So to answer your question, have we seen sustained weight loss after stopping Ozempic? It depends on the person. It depends on why they were on the medication initially. It depends on how long they were on it. It depends on how they were managed. It depends on their other health comorbidities. Is their thyroid in a normal range? Or do they have insulin resistance? So it's not a one blanket statement where you can say, yes, people who stop Ozempic keep the weight off, or no, people who stop Ozempic just gain the weight back. We are really all individuals, and it has to be looked at on a one-on-one individualized assessment. I hope that long answer made sense, but it really isn't as easy as just saying, you stop Ozempic, you'll keep the weight off, or you stop Ozempic, you'll gain the weight back. So thank you for that question. And you said thank you, and you are from South Carolina. So South Carolina's in the house. South Carolina had a great question. Thank you for your question. I really appreciate that. If any of you all have questions, we're doing a weight loss Q&A. Drop them below. Y'all know this is what I love to talk about. So happy to answer any of your questions live. And I have a couple others that were submitted to me before in the DMs. So I'm going to answer those as well. All right. This is a common question I'm asked, and that is your medical weight loss program for Nevada residents only? Yes. So I am licensed in the state of Nevada. So for me to be your primary care physician, or to be your physician that manages your weight management, you do have to be in the state of Nevada. So here at Inspire Primary Care, our primary care and medical weight loss members are for Nevada residents. All right. That's a great question. That question was submitted by someone from our YouTube page. So join us there as well. And thank you so much for asking that question. A lot of people who watch from our YouTube channel are in different states, but we definitely still want to share about quality information, about quality medical weight loss programs, regardless of what state you are in. My recommendation, if you are in a different state that's not Nevada, like South Carolina's in the house, is to make sure you're looking at credentials of the person prescribing medications and the person you're working for. I recommend not just shopping for the cheapest price, which I know a lot of people do. They call around at weight loss clinics and they just try to find the cheapest shot. That is not the recommendation, because although you can find medications inexpensive, you really do get what you pay for. And this isn't to be used as a fad. These are medications. These have an FDA approval. These should be prescribed by someone who is actually trained, a physician who is actually trained in obesity medicine, in weight management. So definitely look at the credentials. Look for a physician that specializes in weight management in your area if you're not in Las Vegas, because if you are, then you already know I'd love to care for you here at Inspire Primary Care. All right. So that is the question about Nevada residents. All right. Two more. The fifth question that was submitted to me is for the injections. If injections are the medication we're going with for my weight management, Do they have to be done in office every week? Because I don't really have time to come to an office every week. So I love this question as well. That is a great question because a lot of weight loss clinics do require for you, if you're utilizing GLP-1 injections for weight loss and weight management, which are the most popular, most effective we have on the market at this time, then a lot of offices do require for you to actually go to the office every week. But I'm going to be honest, we do not do it that way here. Who has time for that? I don't have time for that. And most of our members here at Inspire Primary Care are busy professionals and also don't have time for that. So what happens is that our onboarding appointment here at Inspire Primary Care, I counsel you on how to use the medication. We talk about the pros and cons of all of the different medication options. Together, we decide on the best medication option for your personalized health and wellness goals and weight goals. And then from there, if we are going with GLP-1 injectables, I teach you in office how to use those. I have demo pins. I teach you how to use those. And then I order the medications. They come to your house and you do the injections at your house. So no, I do not have a line waiting outside my office for a weekly injection, having people drive all the way across town for a 2-minute shot. No, we don't do that. So that is also another great benefit of being a medical weight member at Inspire Primary Care is all of this is done at home from the comfort of your home. Your doctor is a text or email away. We're able to hop on the phone, hop on video like this if there are any questions along the way to manage that. All right. Okay. And then the last question is, are you accepting new members and how do I join? Yes, we are accepting new medical weight loss and primary care members here at Inspire Primary Care. You do have to be a Nevada resident, okay? And I would love to be your doctor if you're in the Las Vegas area. You just join by going to our website at inspireprimarycare.com. No I in front of Inspire. There's a big button at the top shaped like the Las Vegas sign. It says enroll. You click that. It takes you through the steps to join. If you have any other questions, drop them in the chat. I will be back for the playback. I'm not seeing any other questions right now, but I will read the playback questions. I'll make another little list of your questions for our next live. If your question, you're like, I don't want to necessarily drop it publicly, you can always DM me. You guys do a great job DMing me questions. I will also go live about those. And if you're like, I'm in Las Vegas and I have a very specific question to my own individual situation, please schedule a meet and greet with me. On our website, we also have a button right at the top to schedule a free virtual meet and greet. We can hop on phone or video, you and I together, and I will answer your questions. So thank you all so much for joining tonight. Thank you for participating and asking questions, and I'll see you on the next live. Have a great day. Bye.